morning. Good morning.
Thank you for your patience. We will get assembled here and start momentarily. The stack is probably a little better to get tighter. Alex will direct you.
2 lines.
2 lines, 2 lines. Aaron, I think you're too.
Excellent. Well, thanks everyone. Appreciate you being here. Grateful for your presence and good morning. I'm California Attorney General Rob Bonta. Welcome to our office here in Los Angeles. We're here today to announce the results of a massive hospice fraud bust in Los Angeles County, and it's called Operation Skip Trace. Operation Skip Trace uncovered and ended a hospice fraud scheme that defrauded Medi-Cal of $267 million. So just to be clear, $250 million. Over. Funds that are paid for by California taxpayers, funds that are meant to provide care to Californians in need. It is unacceptable, it is illegal, and we will not stand for it. Last Thursday, we filed felony criminal charges against 21 suspects, including healthcare fraud, money laundering, and identity theft. And yesterday, we successfully executed search and arrest warrants at 10 separate locations and arrested 5 suspects so far throughout Southern California. I'm going to break down the details of this operation in a moment, but first, I just want to make one point very clear. This is just the latest example of the California DOJ's longstanding, ongoing, and successful efforts to combat hospice and Medi-Cal fraud. We have been doing this work for years. We've been doing it successfully before certain people in this country decided to think about it for the first time. We will continue to do this work. Heads down, sleeves rolled up, important investigative work, prosecutorial work. I also want to make clear, this is our case, a California case from beginning to end. My office worked on it. We worked on it with the Department of Healthcare Services, the Franchise Tax Board, and other partner agencies. This is a California case. We will prosecute this case. We will have it from beginning to end. While healthcare fraud might be President Trump's shiny new political talking point, California DOJ has been going after healthcare fraud since 1979. For decades, Trump is late to the party. Protecting taxpayer dollars and protecting programs sick and vulnerable Californians rely on have been our priority for nearly 5 decades. Our Division of Medicare Fraud and Elder Abuse, also known as DMFEA, is one of the most aggressive and dynamic Medicaid fraud control units in the nation. Just since I came into this office in 2021, DMFEA has conducted nearly 300 hospice-related investigations, filed 119 hospice-related criminal cases, and secured 51 hospice-related convictions. So while some are just starting to discover this issue, we have been on it, holding people accountable, taking down criminal operations. That's just talking about our hospice fraud work, which is only one part of the anti-fraud work DMFEA conducts. Over the last decade, DMFEA has recovered a total of $1.54 billion in civil and criminal Medi-Cal fraud cases. This is our area of expertise. Someone don't lean on the lights. This is our area of expertise. It's our bread and butter. It's what we do, and we will continue to do it. And one of the reasons we're so successful is our partnership with other California agencies. This is collaborative work. This is partnership work. In the case of Operation Skip Trace, that included Governor Newsom and his office. We're grateful to Governor Newsom's leadership and partnership. It included the California Department of Healthcare Services and the California Health and Human Services Agency, which is represented today by Secretary Kim Johnson, who you will hear from in a moment. I am grateful for all of their partnerships. We couldn't do this work without them. This is a collective, joint, collaborative effort. The success is because of the partnership. This was not only a great team effort, but it was really important law enforcement work on full display. And good law enforcement work is team work, is collaborative work. Let me tell you more about this scheme and the criminal operation here. Operation Skip Trace was initially kicked off by a tip from California DHCS, Department of Healthcare Services, of a tip of alleged hospice fraud at 14 companies. DOJ's DMFEA, the Division of Medical Fraud and Elder Abuse, my team, investigated those 14 companies, plus a billing company, and 8 individuals suspected of money laundering. We found that those involved in this fraud, in this scheme, would purchase personal identifying information for people who live outside of California on the dark web, and then enroll them into covered California, posing as California residents. Straw owners then bought up a number of hospice companies and began billing Medi-Cal for non-existent services for those stolen identities. They used fake records, non-existent offices, and fake diagnoses to justify these claims. Meanwhile, the so-called patients were healthy, out of state, and completely unaware that they had been enrolled in hospice care. Once the money was paid out, it was funneled through a complex web of over 130 shell companies and hidden across bank accounts, payment apps, and cryptocurrency to evade detection. The money was laundered. As I said, the scheme racked up approximately $267 million in fraudulent billing. So far, our team has already recovered more than $30 million, with more to come. And we worked with DHCS and the Controller's Office to stop checks worth more than $40 million. This scheme, this criminal operation was no accident. It wasn't a case of billing errors, cutting corners, or upcharging care. This was a brazen, calculated criminal scheme that exploited the Medi-Cal system, stole from the state of California and Medicaid, and prevented services and care from going to sick individuals who actually need it. We've put an end to this fraud, and we intend to prosecute the perpetrators to the fullest extent of the law. They are facing prison time from 10 to 16 years. Let this be a lesson to anyone targeting Medi-Cal and hospice care in California. We're on the case, and we're coming for you. California has a no-tolerance policy for fraud. We're laser focused on rooting out and eradicating fraud that targets our programs, hurts our people, and steals from our state. At California DOJ, that includes the work DMFEA does, day in and day out, to snuff out Medi-Cal fraud, including hospice fraud. To claim this is a uniquely California problem is ludicrous, just plainly untrue, false. Anywhere there's money flowing, anywhere bad actors sniff out an opportunity to seize ill-gotten gains, there's risk of fraud. In California, yes, and also in every other state. While President Trump, First Assistant Saley, and Dr. Oz try to villainize California to score political points, the truth is that the federal government has also increased oversight into hospice fraud in Texas, in Georgia, and in Ohio, among other states. This is a serious issue across the nation, no doubt, which is why California DOJ, together with the governor and our partners across agencies, are serious about tackling it head on and have been doing so for years. It's why we've been on the case for decades, hardening government systems, protecting critical assistance programs, and arresting fraudsters who see our public programs as their piggy banks. While Trump, Saley, and Oz have deemed fraud the flavor of the month in their attempt to resurrect Trump's plummeting approval rating, California DOJ, our law enforcement agents, our investigators, our prosecutors have been on the ground in our communities fighting fraud, fighting waste, and fighting abuse for years. This is not a political game for us. This is about protecting public funds, serving our residents, delivering programs that sick and vulnerable Californians need. Tackling fraud isn't and should never be partisan or political. I've said it before, and I'll say it again. We welcome partnership with the federal government that actually aims to tackle fraud, that puts serving the public above political sparring. In the meantime, California will continue doing the work, continue doing what we have done, and we will continue to do that important work to tackle fraud. I encourage the public to do their part too. Anyone who believes they've witnessed or experienced hospice fraud can submit a complaint on our website, oag.ca.gov/DMFEA/reporting. You can also call us toll free at 800-722-0432. 722-0432. Anyone who believes they witnessed a false claim against the state can contact DOJ's Public Inquiry Unit. You can find more information on our website at oag.ca.gov/contact or call the unit directly at 800-952-5225. We also have specific landing pages for our anti-fraud work generally and our anti-hospice fraud work specifically for those, whether you've had the interest before or are just now getting it, to learn about the work that we've been doing for years, for decades. Finally, before I turn it over to my fellow speakers, I want to express my deep gratitude, my deep appreciation for the members of DMFEA who made Operation Skip Trace a success. Their chief, Jennifer Euler, is right here. She doesn't do this for the recognition. This is a work of passion and public service that she's been doing for years. I'm grateful to have her on my team and to be a colleague of hers as she leads an amazing team doing this work every day. It's tireless, it's passionate, and it is of great asset to the public and to our state. With that, I will circle back for questions, but I want to turn it over now to thank and welcome Secretary Johnson to say a few words. Thank you.
Thank you so much, Attorney General Bonta, for your partnership in this effort, pursuing this case and holding the perpetrators accountable. Thank you also for your broader efforts to protect the Health and Human Services safety net for all eligible Californians who need them. There's a lot of misinformation and disinformation being shared about all of what we're doing in program integrity. You just heard from the Attorney General who spoke to the phenomenal efforts that we're putting forward. And I want to assure you that the California Health and Human Services Agency runs some of the nation's most rigorous, overseen public assistance programs, combining strong eligibility verification, continuous fraud prevention, and aggressive enforcement. Our programs, including CalFresh and other food assistance programs, CalWorks, childcare, and Medi-Cal, support millions of Californians, and the robust safeguards built into each program reflect our commitment to accountability and fiscal stewardship. When the state identifies a problem, we take action. Today's announcement is an example that demonstrates our commitment and effectiveness to act decisively when we see evidence of fraud in the programs we administer. I want to also thank Director Boss, the Director of Healthcare Services, who's joined us today, for her leadership in this effort. As you heard what we found, the Department of Healthcare Services uncovered a large, organized identity theft and hospice fraud scheme that used thousands of stolen identities to exploit the Medi-Cal program. As you heard, the scheme involved 14 fraudulent hospice providers operating as part of a transnational criminal network, mirroring broader fraud trends that we are seeing across the country. These fraudulent providers generated, again, more than $267 million in improper hospice billing. From start to finish, including the complaint, investigation, referral to law enforcement, and finally successful prosecution, fraud investigations often take years. However, there are immediate actions taken to address what we find. The Department of Healthcare Services Audit Investigation Unit and the Department of Justice's Division of Medi-Cal Fraud and Elder Abuse work together to identify the bad actors using fraud analytics and reviewing external reports. California counties helped us rapidly disenroll fraudulent members and protect legitimate members. Managed care plans helped flag the initial concerns and helped stop managed care payments. The California Department of Public Health acted swiftly to revoke licenses. This is the kind of cross-departmental collaboration that we have embedded as a key component of our program integrity infrastructure. The Department of Healthcare Services also halted payments and suspended all fraudulent hospice providers, immediately stopping further misuse of these stolen identities. Again, more than thousands of fraudulent Medi-Cal enrollments were disenrolled, many tied to individuals in other states who had no idea their identities were being used. When we find fraudulent cases, we also reassess our program integrity systems to identify ways we can further strengthen the safeguards in our Medi-Cal program. In this case, we have taken additional actions, making sure hospice claims can only be paid when the right documentation is in place. We are using a faster and more secure online process, and we're adding stronger checks to prevent fake applications or stolen identities from getting into the system. Our responsibility is to protect those participating in the safety net and ensure program dollars are used for the people who are eligible and truly need these services. Any misuse of stolen identities or improper billing is unacceptable and undermines the trust Californians place in this program. So again, thank you to every partner, many of whom are here today, who helped bring this scheme to light, and for your continued efforts to safeguard Medi-Cal and additional safety net programs and hold perpetrators accountable, including through criminal prosecution. We're grateful for this partnership. We will continue to take action as we see steps, and we have the systems in place to really address this across the broader safety net. Attorney General, I'll turn it back to you.
Thank you, Secretary. Thank you, Secretary. Again, appreciate the partnership that brought us to this moment and this day to make this important announcement. And with that, I'm happy to answer any questions that you might have.
Mr. Bonta, if I may, you mentioned 5 arrests, 21 suspects. Can you share the names of the people arrested and where are the 21 suspects? And the locations, you mentioned 10 are being investigated. What were they? Were they office buildings? Were they houses? Can you give us more detail?
Yeah.
About those
Yeah.
figures?
We can share the names afterwards if they're shareable at this point. The different locations include, they're mostly residents with some business locations. So it was a mix at the 10. We have notices appear out for the folks that have not been, are not a part of the 5 that we've already arrested, and we're in active pursuit right now since yesterday of a handful as well. So all of the 21 are accounted for either through an arrest, an active arrest effort, or a notice to appear.
Do the locations have any sort of medical equipment at all?
There was no, one interesting point about this is that there was no medical service provided. So there's no medical professional among the criminal defendants because there was no medical service provided. There were straw purchases of hospice care programs. And so there could be medical equipment, but it wasn't used to provide any care. So this was a front with no services actually provided. And as you know, when someone is enrolled on hospice, they are not able to get the normal non-hospice care that they would get. They're shunted into a different pathway that's hospice only. They're supposed to be terminally ill and towards the end of their life, so they don't get the care, the prevention care, the wellness care that they would normally get. So it's very harmful to the patients.
Attorney Bonta, for him as with la opinion, could you please explain how big is this problem and how complicated it is for local and state authorities or for you to discover this massive fraud? And the third question, how are you going to respond to the grading system that is coming from the White House?
The what coming from the White House?
The grading system that is coming from the White House.
let me answer the last question first. We're not too interested in the grading systems of the White House on this issue. They're just thinking about this issue for the first time. They're late to the party. We've been doing this work for years, for decades, as I've mentioned and I've set forth. We will continue to do the work because it's important work. It's work that should not be political or partisan. It shouldn't be used to try to bludgeon or be used as a cudgel to attack an opposing party or to lift up someone's flagging approval ratings. This is about real work, real people, real taxpayer money, real patients, lives, health, all at risk. And so we're focused on the work. We got our heads down. We got our sleeves rolled up. We're going to do the work. We know it's important work. We know we've been successful at this work, and we know there's more work to do. So we're gonna keep tackling fraud in its many forms, including hospice fraud. This is a very complicated, sophisticated criminal operation. Using identities from the dark web, creating hospice care fronts. They had a ringleader and a biller. There were different roles assigned. There was a very complex network of money laundering to hide the money and make it difficult to detect. So this is complex stuff, requiring very sophisticated, professional, and skillful law enforcement work. We got our tip back in May, not quite a year ago, but coming up on a year, and we got to work immediately. And it culminated in less than a year in a massive takedown that uncovered an attempt to defraud Californians of $267 million. So these are sophisticated cases, but we're up to the task, as we've shown time and time again, including in this case.
Attorney General Bonta, during a first assisting U.S. Attorney Bill Staley's conference last week, Dr. Oz referenced a few numbers. One, he said that a third of all the offices in the country are in Los Angeles, suggesting that was an indication of fraud. He also said he estimates that half of the hospices in Los Angeles County are fraudulent and based that number on death rate. Would you like to respond to those numbers, the inferences there, and your department's own assessment of how widespread hospice fraud is in California, perhaps LA County, and maybe what metrics you use?
Not particularly interested in responding to Dr. Oz's points. He's clearly been more interested in politicization and partisanship than in providing real data-based pathways for progress and solutions. He's done drive-bys in California where he sticks the camera in his face and posts a video and then leaves. We're here doing the work before he came, while he was here, and after he's gone. That's what we're focused on. We have our own data. We know what's out there with respect to fraud. We're tackling it every day. We're doing investigations. We're on the ground. We're doing knock and talks. That's what our team does. So we're not interested in political weaponization, misinformation, disinformation, Dr. Oz's very suspect comments. We're interested in the work. That's what the people of the state deserve. They not quite, but yes. We're interested in doing the work and making sure that fraud is tackled. And there was fraud in California. See all the work that we're doing to stop it and all the takedowns that we're engaged in. There's fraud in Texas. There's fraud in Florida. There's fraud in Ohio. Dr. Oz knows all that because he's focused on those states. And so it is unfortunate that there are those in this federal administration who can only see things through a political lens and want to politically weaponize, and they love to go after the fourth largest economy in the world, the greatest state in the nation, the great state of California. So we expect that. Dr. Oz's comments are what we expect. They're no surprise. We like to work with the actual facts, the actual data, and do real work to tackle fraud instead of talking about it and putting cameras in our faces.
Is your data being used in California?
Hospice fraud, it's definitely significant. And it's definitely, there are certain hotspots, if you will, like with any type of crime or illegal conduct, you can see and you should know about the different hotspots, the flare-ups, where there is more of it than in other places. There's a lot of it in Los Angeles County. There's no doubt about that. That's why we've been focusing on Los Angeles County and the neighboring counties as well. We've been in the Inland Empire. We've been in Riverside. We've been in San Bernardino. We do the work wherever it is. But yes, there's hospice fraud. It's all over the country. The country includes California, and California includes Los Angeles County.
So if there's so much fraud, does that mean you're not doing enough monitoring? Are you guys not on the ball enough to prevent this kind of fraud? If there's so much of it.
Let me just be clear about who's committing the fraud. Criminals are committing the fraud. Bad actors are committing the fraud. People who are breaking the law are committing the fraud. They are responsible for their actions. They are responsible and should be held accountable for their fraud. My office spends a lot of time, and our focus is mostly, our lane is mostly investigations and prosecutions. We take down fraudsters. We identify fraudsters. We surveil them, determine their scheme, and then take them down and hold them accountable, arrest them, prosecute them, and put them in prison. That is our lane.
Sorry to interrupt. Why is there so much fraud in California?
There's fraud throughout the nation. I just want to be clear about that. I think you're repeating Dr. Oz's talking points on that one. California is the biggest state in the nation. So with anything, we're usually the biggest of anything. And so just on a pro rata population basis. To tackle fraud, it's going to take multiple entities working together. We invite the sincere good faith partnership of the federal government, should they wish to give that. We do not welcome politicization, misinformation, disinformation, political bludgeoning. But if they want to work with us, we want to work with them. And we have, including in a case the other day, that was another massive takedown where my investigators, my team were on the ground talking to witnesses and serving subpoenas and engaged in surveillance and taking proffers, something that the federal government wanted to ignore. But there's also, as you mentioned, and I think your main point is prevention. There are important aspects and steps to be taken when it comes to prevention of the fraud, hardening the target, if you will. And the secretary just spoke to a number of those efforts and addressing those.
We've known about this for years. This has been going on for years.
What has been going on for years?
This level of fraud. So
There's been fraud since 1979 that we've been tackling. So, I mean, there's been crime since early days too. I mean, the fact that we continue to have crime is not the fault of the police officers, the sheriff's deputies, the prosecutors. The criminals are the ones who are accountable for the crime that they commit. The fraudsters are the ones who are accountable for the fraud that they commit. Yes, we should harden the target. Yes, California has taken important steps in that regard. They have delicensed multiple hospice providers. We have created a moratorium on new licenses since 2022. As the secretary mentioned, they have tightened the processes for being able to be approved for providing hospice care and receiving payment for hospice care. That's super important. My team has also been involved in public service announcements and public outreach to make sure people know about the red flags. We've done billboards and radio ads, and we're also prosecuting people. And let me just be clear, prosecution, what we do, investigation and prosecution, it does accomplishes many things, including accountability, but it is also a deterrent, which means it prevents others from being engaged in similar conduct when they know they'll get caught and they'll be going to prison if they engage in it. So prevention looks like a lot of different things, and California's on it.
in February, you said that claims of massive fraud in California were reckless and false. Do you want to change those statements?
No, I want to reiterate those.
Attorney Bonta. I have a question about two particular cases. One is in the city of Azusa and the other one in Northridge. In the first case, there was one doctor, Rahib Bua, for 2,800 patients and 126 hospices. He charged Medicare for $70 million. Is he being investigated so far or no? And the other one is Dr. Fariba Hababerian. She's a registered dermatologist, and she charged Medicare $35 million for 63 hospices. And her license was revoked. The license revoked, it is the only penalty for her. Why not criminal prosecution?
So a couple things. We have many hospice fraud cases that we've been engaged in. I mentioned the numbers and in the hundreds. And so we're happy to share with you any of the cases that are resolved, that are out of the investigation phase and either publicly are being prosecuted by us or a law enforcement partner. We do not comment on pending or potential investigations. And you've asked me if I'm investigating those cases. We do not comment on pending or potential investigations.
We have time for one more question.
Attorney General, I have a question. Out of the 21 suspects, how many are all or some of them associated with transnational criminal organizations? And did it involve other individuals outside of the country?
This was a complex organized criminal operation, but at this point, although there are some links to other countries, we don't believe that this was, we wouldn't describe this necessarily as transnational.
Mr. Lee, can you help me understand why 20% of the total number of licenses for the entire country is coming out of LA County?
We don't do the licensing, so sorry, I can't. We do investigations and prosecutions. And I'm not sure that that data point is accurate either.
That's all the time we have. Thank
May
you,
I ask
guys.
a question of the Secretary?
Yeah.
Secretary, you had mentioned that hardening procedures are now in place. When did those hardening procedures come in place? And I may have a follow-up.
Sure. I think as you heard from the Attorney General, right, California has taken a number of steps. As we've seen increase in licensing of hospices, for example, we've established a moratorium that's been in place for the last 4 years. It's a direct action as a result of what we've seen. As I reference here in this case, what we do whenever we're finding any case of fraud is we're taking a look at what we can identify as root cause and putting in new additional protocols and steps where we see that they're necessary to build from. And so again, whether it's really expediting and looking at different ways, we're looking at data, adding fraud analytics based on patterns that we're seeing. These are all actions that we're directly taking as a result of what we're identifying, and then again, strengthening our program integrity infrastructure.
So, forgive me, but when were those measures put in place? Was it recently, 2 years ago? 4 years ago?
The moratorium was put in place in 2022. That means that no new licensed hospice providers could come online. And I think I just take the opportunity and appreciate the question. There's a lot of conversation about finding hospice addresses unlicensed settings. That again, we license providers. So that's again out of the purview, and we want to make sure that people really understand that. There is a current moratorium. It's currently in place through January of 2027 for no new licensed providers. So that's just again to provide clarity. So when we're seeing kind of reports of new things where people aren't providing services and they're not licensed, that's not a licensed hospice provider in California. So we appreciate the opportunity to provide that clarification.